Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. My name is Bridget Sager, and I'm your host. This episode is to help those of you that are nurses or nurse practitioners and you're trying to decide what path to take for your functional medicine education. I wanted to start by telling you a little bit about my journey of learning functional medicine. If you've heard other episodes, maybe you've heard bits of this before, but I had hoped that my nurse practitioner program was going to be what I had been looking for in regards to finding some really great solutions for my patients. That ended up not being the case, and seeking better answers, I was exploring all over online and many research avenues until I found functional medicine and nurse coaching, which for me has been a really great combination. Initially, I was taking what is functional medicine? I heard the term. I'm looking all over the place online trying to find out what it is. And if you have done this yourself, you know exactly what I'm talking about. Even if you listen to some free courses and you try to start to get some tidbits on maybe particular topics in functional medicine, it doesn't really make that much sense. And so what I was experiencing was taking maybe a course on gut health or listening to a lecture on thyroid or hormone balance, but I wasn't really seeing the big picture. And that is when I became motivated to seek a larger paid program. And I did full training in two of the most respected functional medicine programs, one of those being the Institute for Functional Medicine, as you know. And so I wanted to talk a little bit about my experience learning functional medicine and then how that translates into why I developed the course that I teach and what you can consider when you're looking for next steps in learning functional medicine. I initially took a different program and it was designed for unlicensed providers, and it was geared towards, it wasn't really for necessarily healthcare practitioners, and it wasn't taught by a healthcare practitioner. And so I had made the upfront investment, a significant amount of money, and then found that the majority of the education was getting those unlicensed, they're not nurses, they're not physicians, up to speed to where our foundational education. So that was really frustrating for me because I had invested quite a bit of money and time into learning functional medicine and was finding that it was kind of laying out basic healthcare information and then adding some more information on top of that, but it wasn't super organized. And so I struggled with that as well. I then started to pursue training through the Institute for Functional Medicine, kind of overlapped the two, and found that I was getting a lot more in-depth information and a lot of benefits that I got from doing training through the Institute for Functional Medicine that I will touch on during this talk today. What happened as I was learning in the free courses and the two programs and in all the training that I've done in functional medicine is I kept realizing how little of the education I was getting was from nurses or nurse practitioners, and how little of an acknowledgement there was that really what we were talking about most of the time in these courses was nursing care. And so a light bulb went off for me, and I realized that what we offer in functional medicine is really functional nursing. It is holistic nursing. It is the foundations that we learn in nursing school. And I honestly feel, you may have heard me say before, that I feel like nurses leave school and go into the allopathic healthcare system. And what we have to offer our patients that we have learned in nursing school, this big idea of a holistic approach, is undervalued in our healthcare system and unacknowledged. And so a lot of nurses find that they fall into this system of making sure medications are passed in the hospital setting and long-term care facilities. Patient compliance with provider orders becomes a really big focus, and education goes by the wayside. The holistic approach goes by the wayside, a lot of the time due to time demands, lots of factors. And so I was realizing more and more how valuable the role of nursing is in functional medicine and how little that was being acknowledged and in the courses I was taking, because they weren't written for nurses by nurses. And so that is exactly why I wrote the course that I teach, Functional Medicine for Nurses, is because I wanted nurses to have functional medicine presented in a way that I hadn't experienced in my early time learning functional medicine. I wanted it to be organized and in the language of nursing so that it made sense. And I've gotten a lot of great feedback. So I'm hoping that that's how my students are feeling about it. I definitely have heard that quite a bit, that hearing it spoken in other courses is great, but when it is translated into the language of nursing, it's really meaningful. And so I'm really honored that I get to do that. And so now I'm teaching hundreds of nurses and nurse practitioners. And we talk about these next steps. What do they want to do after they finish the course? Of course, I am going to continue to develop new material and courses for nurses to practice functional medicine as I finish my doctorate over the next few months. So keep an eye out for that. But many of my students take many different approaches when they complete the course. So that's what I wanted to explore a little bit now. A lot of nurses have already started their own businesses or they work as a nurse coach when they come to the program. And they are like, okay, now I'm going to apply this to what I'm doing now. And I understand what functional medicine is. It is fully within my scope of practice as an RN or a nurse practitioner, and I'm ready to go. So I have a lot of students that take the course and incorporate it into something they're already offering, and that is everything to them. And then I also have students that still work in the hospital setting, urgent care, school nurses, you name it, lots of settings. And they take what they learned from the course and now they really understand what functional medicine is. They feel empowered as a nurse to provide more holistic care, and they feel really satisfied with what they've learned and they don't feel the need to move on. At the same time, we talk a lot in the course about how a lot of the students will mention that they have found a niche for the first time, something they feel really passionately about, and that they want to learn more about that topic. And, a good example is like hormone health. We talk about the injustices in our allopathic healthcare system for sex hormones for women and how that is managed throughout the lifespan. So that tends to be a really passionate topic for a lot of my students. But brain health is a huge topic. I mean, I could go on and on about all the different niches you could do in functional medicine as a holistic nurse. But when that comes up, then we talk about, okay, well, where are you going to learn that? What is a respected source? And we're really fortunate to be partnered with the Institute for Functional Medicine so they can take the AFMCP course and then the advanced practice modules. They don't have to be taken in order, and so some of my students will choose to just take the hormone module, and then they feel like they've gotten a really deep dive into that topic, and they're ready to practice. Some of my students want full training, and they wanna become IFMCP certified, which is the certification the IFM offers, and so they will take advantage of that discount and do the full program. Students often ask me about that certification topic, and, I always say in nursing, we tend to get board certified in things through nursing credentialing organizations. For example, if you're a critical care nurse, you get the CCRN. If you are a nurse coach, you get the nurse coach board certification. There is not one yet in the field of nursing for functional medicine. And so IFMCP, that is the certification you can obtain after doing the full program through IFM, is what I recommend in the meantime for those that are really motivated to be certified. Um, that being said, I also feel like there are other courses that offer certifications that you can take in functional medicine. They're all assigned by that school, so there's varying levels of credibility there. The thing that I will say about it is whenever I look for jobs in functional medicine, just out of curiosity for myself, but mostly so that I can inform my students of what's out there. I see over and over again, and I see it in threads online, is that the IFMCP certification is what employers are seeking. And so if my students are looking to get a position and be hired in functional medicine at, say, a functional medicine clinic, the IFMCP certification is the way to go. The one thing that's really unique about IFM is that they are nonprofit. They are, our go-to resource really for in functional medicine for staying on top of the research and where we're headed next as a community of providers. And so I think that's really important to acknowledge, and I didn't want to forget to mention it, is that, they're not there for profit, they're nonprofit. It's an organization to support all of us. And so I know that they are the certification that is sought after by employers. That means a lot to many of my students that want to work in a functional medicine practice. Many of my RN and NP students tell me that they found positions after doing this course with me and that they're going to be working towards certification because that was a really important aspect of them getting hired on to the position that they're starting. So that's really exciting too. Another thing to consider when we're talking about the idea of where to learn functional medicine is the idea of staying connected. I think for me, this year was the first year that the AIC IFM's annual conference was in person, and it was really meaningful for me to be able to be in person with a large group of other nurses and nurse practitioners and physicians that are practicing functional medicine and most of the most respected experts in our field all in one place. That was wonderful. I really love that IFM has the AIC every year. It's just been online the last few years, so it was great to be back in person this year. But I think that those organizations being able to stay connected after the course, and so there are other courses in functional medicine that might not have that camaraderie and that sense of community that we have created, and I think that's important to think about too. Length of program is important, right? Because the course that I teach is 12 weeks long. It is a foundation in functional nursing. It is what is functional medicine in the nursing language. So it's a strong foundation, but some people choose to take like the IFM course, which you take in succession over a period of time when the courses are available. And so that can take several years for some people, depending on timing and if they're able to take those classes when they're live. So look at length of programs when you're considering other options. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. Some of the programs are significantly more expensive now. So I felt like cost was a priority for me, and I wish that I had known a little bit more about the direction to go in sooner. Um, and this next part I think is really important. It is who is teaching you. And this is really what I want to be the take home today is when I take a course through IFM, the expert in that field is speaking on that topic. And for me, I tell my students all the time, I am never going to be the greatest expert in functional medicine in these really deep dive topics like cardiometabolic health or cardiovascular health, right? We have lots of really experts in their field on endocrinology, toxicity, detoxification. I can think of a lot of really respected speakers and educators that I have learned from in those fields. That is not me. I am not trying to pretend to be like the most expert person in functional medicine. But what I do feel that I am an expert in is the language of nursing and functional medicine. And so I really appreciate that we have those people to lean on. And so if for instance you're taking an advanced practice module through the Institute for Functional Medicine, you are taking those courses from probably the most respected expert on that topic that you could possibly be hearing that information from. They are held to a high standard as far as the references that they're using and the information that they're providing. And I really value that because you can go online and find lots of folks that are teaching functional medicine with varying backgrounds. They may not even be a healthcare practitioner. They may not have the level of training that the providers at IFM do. They may not practice in healthcare, which is interesting as well. So I really encourage you, if you're looking at other courses that you could take, to ask yourself, who's teaching me? What is their background in this? Are they a licensed healthcare practitioner? Are they the expert in this topic? I feel really comfortable teaching the course that I teach that's a 12-week course specific to nursing and functional medicine. I think that if you're trying to take a course that's really extended, it should be taught by a variety of experts in their field and speaking their language to you and helping you understand their niche in more depth. So, asking what is their trade? What field do they work in? Are they the expert on this topic? What's their background? What's their level of education? I'm finishing my doctorate right now, and I think back from the time that I first learned nursing till now, and the way that that has progressed. You may know this if you are a nurse that's been trained in the master's or doctorate level, that you more and more in those courses that lead to the master's degree and doctorate, um, you're learning more about how to analyze research and disseminate it and a lot of more advanced topics. And I think that's really important to acknowledge is that we want educators that are doctorally prepared teaching functional medicine. We want to look for providers that are doctorally prepared to teach us what we are learning. So whenever I'm trying to find a topic to learn on, I'm looking for the expert in that field and I'm looking at what training they've had. And the big thing for me with that is just so much of functional medicine is about us staying on top of the research. And we can't do that if we don't have the training behind our name that we have personally learned how to analyze and interpret and disseminate that information and ensure that it's quality research that we're sharing. Another thing to think about is teaching style. I have a couple of functional medicine educators that I adore listening to, and when they teach, I always tune in because I love their energy and enthusiasm and the way they present material. And so I think considering if you're going to be listening to somebody speak on a topic for maybe hours on end weekly, that you really enjoy their learn that what is their background as an educator? Have they taught at a university or college level before? Do they have training as an educator? I am finishing the last little bit of my doctorate right now, and I, just like you, I'm sure, have encountered many types of educators with varying teaching styles and experience. Some of these experiences have been positive and some not so much. Um, when I began teaching nurses at the college level, I started to look at this with a little bit more scrutiny. And now I really pay a lot of attention to how is the material presented? Does it consider lots of different learning styles? When I realized there were all these other aspects to teaching than just getting in front of a classroom and being brave enough to speak, I found that I needed to transition to becoming an educator and not speak only as a nurse practitioner, certified as an online educator. I did a lot of training in that and training in how to be a college level professor. And subsequently, I became certified as a certified nurse educator, which is the board certification for nursing in education. I did this to lend credibility to what I offer my students. I wanted them to know that I take very seriously the role of an educator. My background as an educator and these certifications offer reassurance that I take the role of educator, not just nurse practitioner, not just a nurse practitioner teaching other nurses functional medicine, but my role as an educator very seriously. I really believe that this is reflected in the courses that I develop. So, what should you be considering when you are considering taking other courses? If you're looking at other courses, here's some questions I encourage you to ask yourself. What do you want to learn from them? And what is their background as an educator? What is their level of education? Are they doctorally prepared? If you look at the list of educators through the Institute for Functional Medicine, for example, you're going to see that everyone there is a respected expert in their field. They have a master's at minimum, but most often a doctorate in their specialty. And they have a lot of experience and enthusiasm for education, which I think is really important. What is their degree in? Are they even a healthcare practitioner? That is important to talk about too. Let's acknowledge that. Who are they training? Are they training a group of other licensed providers similar to you? Are they training just nurses and you get to cut out some of that middle information that you don't need to hear because just like what I mentioned about the course I teach, I'm speaking the language of nursing. We're not getting other folks up to speed that don't have any healthcare experience. And so I think that's important, especially I know a lot of nurses, time is valuable. And so that's something to consider as well. Do you need to be a licensed healthcare practitioner to take the course? That is a question to ask that I think can really help you to avoid courses that are going to spend a lot of that time getting other people up to speed with like what we learned in our foundational nursing courses. My experience taking courses that were designed for non-licensed lay learners, like health coaches, has really encouraged me to look closer for courses that are only teaching licensed providers, and I definitely encourage you to do that as well. Are they the expert on this topic? That I think is the most important thing. Do other practitioners look to them as the expert in their subject matter? For example, we have Dr. Terry Walls, who we all know is an expert in multiple sclerosis. We have Dr. Mark Houston, who is a cardiologist who is functionally aligned and teaches us quite often in functional medicine on that topic. There are numerous experts that I could speak to right now. And I think the bottom line and some free ways to keep learning even after the course through Inca is to follow those experts on social media and read their newest books, attend the conferences where they're speaking, get your CEs you need, and you can justify maybe a little getaway if you're doing that in person. But feeling connected to like-minded providers, I think, is important. I think there's nothing wrong with us not signing up for more courses and choosing to follow these people that we respect in their social media accounts and listening to what's on their mind that week. I think that's really fun to do, hear what they're speaking to, if they're going live on social media and sharing their thoughts that day. That's really fun, and it keeps us really feeling that we're aligned with the emerging topics and research that's coming out. I love going to conferences and I love traveling. So I really enjoy being able to go to a lot of the conferences. And I should do a podcast episode on all the ones that I enjoy the most. So I feel like that's a really great way to evaluate what your next steps will be. I think the right answer for me, for my students that ask me what to do next, always will be, if you have found a niche that you're really interested in, take one of the discounted advanced practice modules that IFM offers our students and see where you go from there, because that can be a fairly affordable option to get a really deep dive into a topic you love. And you don't have to decide right then to commit to doing the full certification, but you can get some really great information on something that you already know you care deeply about and see where you go from there. It's not a full commitment. And if you want to stay up to date with what I'm developing as I finish school in the coming months and what's coming right afterwards, be sure to follow me on Instagram and Facebook. It's my handle for both is Bridget Sager NP. There are links in the show notes. I have posts there that share our most recent podcast episodes and blogs that I write. That's a good place to keep track of what I'll be doing next as an expert in functional nursing. I hope that this episode was helpful for you. I have had so many students write and ask me for advice on what to do next. And it really is a personal decision, right? It's like being a career counselor if I were to get that in depth with each person on what to do next. And since we've had hundreds of students go through the course now, and soon it'll be thousands, and I just wanted to create this episode to answer some of those questions that come up often and kind of give my overall impression is that we're all unique in our journey to becoming who we are as a nurse today and what that means to us moving forward, how we want to take functional medicine and apply it in our practice, how much we want to learn, and do we want that certification like the IFMCP that a lot of employers are seeking? Are we just happy to understand what it is and the role of nursing in functional medicine and how to use our holistic approach to help people? I always say, we don't need a lot of fancy tests and a ton of supplements to make a huge difference with people. They need nurses because they need a partner in navigating the healthcare system and addressing our modern life and the impact it has on our health. So I think that a registered nurse with a background in functional medicine is probably the best partner that a patient can have on their health journey. I hope this episode has been really helpful for you. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.